will prevent the spread of Mpox.
Okay, so how effective or how trained are health practitioners to handle this Mpox? Remember the era of COVID in 2020, when a lot of health practitioners were not even trained to understand what COVID was, and so it's almost got out of hand. But for Mpox right now, do you believe that health practitioners have been adequately trained to handle this?
Now, I don't think that they have been adequately trained, but there are opportunities for them to train. There have been structures, including self-paced learning platforms that have been used during the cholera outbreak, Lassa fever outbreak, COVID outbreak. I would encourage the NCDC and other government authorities to use some of these platforms to ensure that the right message is passed to the health workers. So our health force needs to be well trained. But then there are other issues, right? One of them is, do they have the protective equipment? Simple things like gloves, right? Some health facilities in these states, they don't have gloves, and sometimes they expect patients to buy these gloves. For someone who is poor and maybe with case of Mpox that can't even afford a glove, the health worker is at risk, because then he or she is not protected. So in addition to training, we must ensure that we provide the right tools for our health workers to do their work. And then the other problem, which is also a bigger problem, is the lack of human resources. So most of these communities, there is no adequate human resource, and we make use of ad hoc volunteer staff who are volunteering, who are not always there. And sometimes in the case of outbreaks like this, since they are not being paid, they're just volunteering, they stay away. I then find out that some of these health centers are not manned by any health worker. And then if someone has a case, the person is left and maybe spreading the community without even knowing how to protect or isolate him or herself. So we have real challenges in our health system that needs to be fixed. And I think we all need to come together to address this, train our health workers, make sure we have enough human resource for health, and then also we're providing them with the right tools to do their work safely.
All right, Dr. Obinna Iberim, we thank you very much for your insights on curbing Mpox in Nigeria. Many thanks.
You're welcome. Thank you.
Right, and we went to the streets to ask Nigerians this question on who is to blame if a male or a female barges into a restroom designated for the opposite gender. Let's check out their responses.
I watched carefully, I could have known that is a male toilet. But now that I do not know, I have to apologize to the men that I'm sorry for that.
The female that entered there and bagging into the toilet, she's the one to be blamed. Because number one, in a normal situation, even though the place is labeled female, you have to knock in. Who? Is anybody there before you enter?
I should be blamed because I should have looked well before entering first. And secondly, I didn't close the toilet after me, the toilet door after me. So if the person had pushed the toilet door and it was locked, he wouldn't have barged in.
I know very well. Maybe it will be indicated somewhere that this one is for male, this one. So I have to check. So in that aspect, for me not to check and to go into female's toilet instead of the one that is meant for males, I'm to be blamed. But then, in as much as it is now, the female that just barged in has to be blamed too. Why? Because you don't know who is inside. In fact, even if in your own house, once you go out, if you are staying with your roommate or any other person, once you go out, as you are coming back, you have to excuse before going inside.
A lady barging, then you shouldn't blame the lady, because it's already tagged there, female toilet. But what that man or that male need to do is to apologize, because it's for female. But because it was press, that's why he was using it as alternative.
Well, there are so many reasons, but one of, I think the first would be